COVID-19 pandemic 2020. If you like this video, comment down below and uh, push a like button and subscribe. Now, in this contents of the coronavirus, we will be discussing what the virus is and how it spread and how to contain it and how to maintain it, like to stop the spread of coronavirus. And if a person gets infected with it, how will you cure and what is the prevention of it? Now, what is coronavirus? A coronavirus is a kind of common virus that causes infection in your nose, sinuses, or upper throat. In early 2020, after the December 19 outbreak in China, the World Health Organization (WHO) identified SARS-CoV-2 as a new type of coronavirus. The outbreak quickly spread around the world. COVID-19 is a disease caused by SARS-CoV-2 that can trigger what the doctors call respiratory tract infection. It can affect your upper respiratory tract, sinus, nose, and throat, or lower respiratory tract. Scientists now have identified 8 strains of coronavirus as of till up to date. Now, the symptoms of COVID-19. The symptoms can vary from person to person. Now, we will be discussing about the common symptoms present mostly in many of the peoples affected with COVID-19. People with COVID-19 have a wide range of symptoms ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19, like fever. In 99% cases, fever is the most common among all the symptoms. We don't care if we have fever, but we have to take in consideration, we have to treat it seriously if anybody has fever of any sort, whether it's mild or above 100 or 99 degrees Celsius, or like having a fever like symptom, cough, shortness of breath or difficulty in breathing in 31% cases, fatigue in 7% cases, muscle or body ache in 35% cases, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea and vomiting, and diarrhea. Now, in these symptoms, fever, shortness of breath, fatigue, body ache, and muscle or body ache is the most common. The other symptoms vary slightly in accordance with person to person. Coronavirus risk factors. There are some risk factors associated with coronavirus that increases the coronavirus affinity, or would I say that it greatly increases the symptoms or the chance of survival or the chance to be cured. Anyone can get COVID-19. And most infections are mild. The older you are, the higher your risk of severe illness. You have a higher chance of serious illness if you have one of these health conditions: chronic kidney disease, chronic obstructive pulmonary disease, a weakened immune system because of an organ transplant, and maybe a major surgical intervention, obesity, serious heart conditions such as heart failure or coronary artery disease, shackle cell disease, type 2 diabetes, conditions that would lead to severe COVID-19 illness. Now, in these conditions, this would severely hamper uh, uh, a person or a patient's recovery in case he or she gets COVID-19. Now, these are the diseases that will severely hamper a person's recovery rate. Moderate to severe asthma, disease that can affect your blood vessels and blood flow to your brain, cystic fibrosis, high blood pressure, a weakened immune system because of blood or bone marrow transplant, HIV, or medications like corticosteroids, dementia, liver disease, pregnancy, damaged or scarred lung tissue, smoking, thalassemia, and type 1 diabetes. Now we should take in consideration about these diseases and to minimize these comorbidities, so as to not to be uh, not to be hampered with this. Now in pregnancy, we can possibly just prevent this, but other of these diseases we can prevent, or we can maintain these disease with drugs, prevent this disease with drugs, or control this disease. Now we will discussing about the current symptoms in children, which is happening with very few, but we should take in consideration about this disease, which is named Kawasaki disease, which was originally found in Japan. Mm, so we will discussing about this Kawasaki disease in children. Some children and teens who are in hospital with COVID-19 have an inflammatory condition that doctors are calling multi-system inflammatory syndromes in children. Doctors think it may be linked to the virus. It causes symptoms similar to those of toxic shock and of Kawasaki disease, a condition that causes inflammation of kids' blood vessels. Now, in this case, the Kawasaki disease is mainly an coagulative disease, and mostly it's seen on the skin and shown like patches, as seen in the picture. It is very serious disease, or in case of children's, because it may cause blood clots and some of the multi-organ failures in many of the children's. The Kawasaki disease has been found to has been found to occur in few occur in many of the children's nowadays. So we should be cautious about this disease, about this syndrome. Now, coronavirus transmission. Now, in this slide, we will discussing about the coronavirus transmission and how we can prevent this transmission, or break the chain of transmission. How does the coronavirus spread? SARS-CoV-2, the virus mainly spread from person to person, like with sneezing and with respiratory droplets. And in this type of infection, if we touch a thing, or if we touch an object that a person sneezed on, we can also get the coronavirus. Most of the time it spreads when a sick person coughs or sneezes. They can spread droplets as far as 6 feet away, so we have to be mindful about that. Now that the droplets spread about 6 feet away, so when we sneeze, we should uh, we should carry with ourselves tissues or napkins, and we should always wear a mask so that we don't spread the disease. If you breathe them or swallow them, the virus can get into your body. Some people who have the virus don't have symptoms, but they can spread the virus. You can also get the virus from touching a surface or object the virus is on, then touching the mouth or nose or possibly your eyes. Most viruses can live for several hours on a surface that they land on. So we should be very mindful about these things so as to stop the coronavirus spreading and break the chain of transmission. Now we will be discussing about the coronavirus spread and how they live on how they survive on different types of surfaces and how they last on those surfaces. So in case of copper, it is 4 hours. So after 4 hours, the coronavirus um, usually dies out on copper surfaces. On carbon surfaces, up to 24 hours. Plastic and stainless steel, 2 to 3 days. That's why it is important to disinfect surfaces to get rid of these viruses. Some dogs and cats have tested positive for the virus. A few have shown signs of illness, but there are no evidence that humans can catch this virus from animals. But still, we have to take precautionary steps so as to not get transmitted by cats and dogs. Now we will discussing about community spread. As a lot of you know, the virus is transmitting at a very alarming rate, and in this in this day, we see that the virus has spread all over the world because of community transmission. Now, from person to person, the virus is transmitted to all the communities, and from these small communities, the virus has spread all over our country and all over the world. So, in this slide, we will be discussing about um, community spread. Doctors and health officials use this term when they don't know the source of the infection. With COVID-19, it is usually refers to someone who gets a virus even though they haven't been out of the country or haven't been exposed to someone who travel abroad or who has COVID-19. Now, how fast is it spreading? Now, in this chart, we see that the COVID-19 spread in US up to August 26, 2020. Now, the case spiked in July, but and is dropped at 26th August. You can see how it has reached to a climax, and so many peoples are affected at July. So it's spreading very fast every day. Now, how contagious is the coronavirus? Our transmission rate is relatively high. Every research has estimated that one person who has it can spread it to between 2 to 2.5 percent, 2 to 2.5 persons. One study found that the rate was higher, with one case spreading to between 4.7 to 6.6 other peoples. By compressing, one person who has this seasonal flu will pass it between 1.1 to 2.3 others. So in this paragraph, um, we see that how the transmission rate is high in comparison to seasonal flu. In case of seasonal flu, it transmits to 1 to 2%, and in case of coronavirus, it transmits to 2 to 2.5%, which is very high, which is higher than seasonal flu. And in some studies, it has been found that the spread of coronavirus is 4.7 to 6.6%, which is much higher than seasonal flu. That is why this coronavirus is spreading at an alarming rate. We can work to lower the transmission rate by washing hands often, keeping common surfaces clean, limiting contact with other people, and wearing cloth face masks when we can't stay 6 feet away from others. And in this line, we are discussing about how we can prevent it by washing our hands. We can prevent coronavirus transmission by washing our hands often with soap for 30 seconds, and with hand sanitizer. We can rub a hand sanitizer on our hand and keep it for 20 seconds. And we should wear a mask in public places if we go outside, and we can't maintain a safe distance of 6 feet away from others. Can coronavirus be transmitted through groceries, packages, and or foods? How much more likely to get COVID-19 from another person can than from packages, groceries, or food? If you are in a high risk group, stay home and use a delivery service or have a friend shop for you. Have them leave the items outside your front door if you can. If you do your own shopping, try to stay at least 6 feet away from other shoppers. That isn't always possible. So wear cloth face masks too. Now, um, in this paragraph, it is discussed that if a person can't do shopping, or at least shopping or other daily chores, he or she should stay at home, use a delivery service, and um, and ask a friend or family member to shop for them, because in the packages and groceries and foods, they can transmit COVID-19. So we should be mindful about these things so as to stop the transmission of COVID-19. Now, I have discussed it earlier that you should wash your hands 20 seconds before and after bringing things into your home. The coronavirus can linger on hard surfaces, so clean and disinfect countertops and anything else your bags have touched. You can wipe down plastic, metal, or glass packaging with soap and water if you want. There's no evidence that someone has gotten COVID-19 from food or food containers, but you should still be mindful about washing those things with some soap before you put it in refrigerator or consume these things. In case of vegetables, you should wash them with water, with some salt, and dip them in salt water for about 20 minutes. And for food containers, you should wash them with soap water and outside, so that if there are any coronavirus, they should die out. Now, how can you diagnose a coronavirus? Uh, we can diagnose a coronavirus by seeing some of the symptoms and by testing about the coronavirus. Now, we should call a doctor if we see these symptoms: fever for 100 degrees Fahrenheit or higher, cough, and trouble breathing. In most countries or states, decisions about who gets tested for COVID-19 are made at the state or local levels. Now, if we see the symptoms like fever of 100 degrees Fahrenheit, higher, cough, and trouble breathing, we should immediately call a doctor or get tested for COVID-19. Now, about the test. A swab test is the most common method. It looks for signs of the virus in your respiratory tract. The person giving the test puts a swab up your nose to get a sample from the back of your nose and throat. That sample usually goes to a lab that looks for viral material, but some areas may have rapid tests that give results in as little as 15 minutes. If there are signs of virus, that test is positive. Um, a negative test would mean that there is no viruses or wasn't enough to measure. That can happen early in the infection. It usually takes 24 hours to get results, but the test must be controlled, stored, shipped to a lab, and processed. The FDA has granted emergency to authorization for tests that don't have full approval yet. These include home nasal test, a home saliva test, tests that check your blood for things called antibodies. Your immune system make antibodies in response to the infection. A swab test can only tell whether you have a virus in your body at that moment, but an antibody can show whether you have been exposed to the virus even if you didn't have symptoms. This is important in official efforts to learn how widespread COVID-19 is. In time, it might also help to figure out who's immune to the virus. Now, in this case, now the swab test is usually done in most cases, which tells the doctors that if you have COVID-19 at that moment or at that time. But an antibody test is mostly an effective way of determining whether you had or have COVID-19. Because when a person gets infected with the virus, the person produces antibody, which is floats in the blood and it stays there. So if you had a COVID-19 in the past, then the antibody test can detect these antibodies and uh, and eventually gives a clear cut and 90% accurate test of COVID-19. Coronavirus prevention. Now, to prevent coronavirus, we have to take these steps. Wash your hand often with soap and water or clean with alcohol-based sanitizers. Practice social distancing. Cover your nose and mouth in public. Don't touch your face. Usually, if we go outside, we touch our face and our nose. We should uh, stop stop doing this in public places, because if we touch a thing and then place our hands in our mouth, on our mouth or on our nose, then if we have viruses on our hand, these gets transmitted to our nose or to our mouth, and we can catch the COVID-19. So we should uh, practice not touching our hands or touching anything in public. Should wear some plastic gloves so that we uh, don't get coronavirus through touching these things. And we should clean and disinfect. You can clean first with soap and water, but disinfect surface you touch often, like tables, doorknobs, light switches, toilets, faucets, and sinks. Use a mix of household bleach and water, one third cup bleach per gallon of water, and 4 teaspoon bleach per quart of water, or household cleaner that's approved to treat SARS-CoV-2. You can also check the Government Protection Agency EPA website to see if yours made the list. Wear gloves when you clean and throw away when you're done. There's no proof that herbal therapies and teas can prevent infection. Coronavirus preparation tips. In addition to practicing the preventions tips listed above, you can meet as household or large family to talk about who needs what. If you have people at high risk, ask their doctors what to do. Talk to your neighbors about emergency planning. Join your neighborhood chat group or website to stay in touch. Find community and organizations that can help with healthcare and food delivery and other supplies. Make an emergency contact list, including family, friends, neighbors, carpool drivers, doctors, teachers, employers, and local health department. Choose a room or rooms where you can help someone who's sick or who's exposed who's been exposed, to place them in separate from the rest of you. Talk to the child's school and about keeping up with assignments if the child can go to the school. In today's situation, most of the children are at home and doing their assignments online. So it's done most by most of the peoples. Save yourself up to work from home if your office is closed, and reach out to friends and family if you live alone. Make plans for them to check on you by phone, email, or video chat. Now, um, the debating topic about, can a face mask protect you from infection? Now, the CDC recommends that you wear a mask if you go out in public. This is an added layer of protection for everyone on top of the social distancing effort. You can spread the virus when you talk or cough, even if you don't know that you have it or if you ain't showing signs of infection. Surgical masks and N95 masks should be preserved for healthcare workers and first responders, the CDC says. Now, how can you help stop the spread of the coronavirus? Some officials are easing restrictions, allowing business to reopen. This doesn't make the virus. This doesn't mean the virus is gone. Continue to follow safety practices such as wearing cloth, face masks in public places. Because the virus spreads from person to person, it's important to limit your contact with other people as much as possible. Some people work in essential businesses like um, like drugstores or businesses that will to monitor funding like banks and hospitals that are vital to daily lives, such as healthcare, law enforcement, and public utilities. Everyone else should stay home as much as you can and wear cloth masks, even when you can't. Uh, when, you might hear officials use these terms when they talk about staying home, social distancing, or physical distancing. Keep space between yourself and other people when you have to go out. Quarantine, keeping someone home and separate from other people if they might have been exposed to the virus. And isolation, keeping sick people away from healthy people, including using a separate. Intense research to create one has been underway around the world since scientists shared the virus' genetic makeup in January 2020. Vaccine testing in humans started from record speed in 2020. More than 100 vaccine projects are in various phases of development, such as Sputnik and uh, in in Russia, and America is trying to develop the corona vaccine, and also the Chinese vaccine. They are in trial stages, not um, not in supplied or not approved till now. So thank you for viewing this video, and if you like this video, give a thumbs up and subscribe to my videos. Subscribe to my channel for more videos on health and health related um, problems and diseases. So I will update you on different diseases and different health problems and remedies and management of those diseases.